There are mixed reactions to the scrapping of the remaining COVID-19 regulations, including the wearing of face masks. Health Minister Joe Phaahla made the announcement this week, citing declining infection rates and that South Africa has exited a recent spike of infections. Will this make a difference to future infection numbers, and what is the likely outcome given our own health profile in South Africa? Let's ask epidemiologist and director of Caprisa, Prof Salim Abdool Karim. Thank you very much for your time and for joining us this evening, Prof. Did we do this too soon?
Good evening, and it's good evening to all of the viewers. No, I think we know that in South Africa, the infections come in waves. And we're very fortunate that we've now overcome the fifth wave, which wasn't too serious. And that wave ended a few days ago. And now that it has ended, we are pretty reasonably confident, based on past trends, that we will see about 3 months of low transmission. Now, in these 3 months, this is a good time to ease our restrictions and our public health measures.
Easing is one thing, but it looks like we've made a complete sort of change, a 180 sort of degree change in the regulations. I'm going to put a pin in that point because I want to come back to it just now. But I'm thinking about places like France seeing a spike in infections after they eased regulations. It seems the World Health Organization says countries in Europe are lifting their restrictions too soon and too brutally, giving rise to these infection spikes. So how seriously as a country should we be looking at those trends?
I think we got to look at what's going on in all of the countries right now, because we need to learn what are the variants, what is the virus that is spreading there. Now, in Europe right now, there are 2 variants that are spreading. One is called BA.1.12.1. Now, that particular variant we haven't had in South Africa. It's unlikely that we'll have it here because there's cross immunity. But the real important variant spreading in the UK and in much of Europe is called BA4. Now, we've already had BA4. BA4 is what, and BA5 are the ones that caused our 5th wave. So we are not at this point concerned that those particular viruses will lead to spikes in South Africa. And that's one of the reasons why we can be reasonably confident that easing restrictions will not lead to a spike at this time. However, this is an unpredictable virus, so we could very easily be seeing a new variant, and we can expect a new variant in a few months' time. But during this period of low transmission, this is a good time for us to ease restrictions.
Okay, so in connection with that point, you talk about something called a prevention holiday, and you've mooted this as a way to mitigate a resistance to the return of regulations if needed, and if, as you're saying, the projection could be there in a couple of months for us to reevaluate. How do you see these 2 worlds playing out?
It's very difficult, man. And you've actually touched on, for me, one of the biggest challenges all countries are grappling with right now. That when you ease restrictions, it's very hard to reinstitute them. And I have little doubt that when another wave hits our country, we will need to increase some of our public health measures and put them in once again. But until that time, we have this period as a little bit of a holiday time. So does a holiday or a period where we don't have restrictions, does that enable people to be more compliant when the restrictions are in place? In other words, can we just switch it on and off? And when we switch it on and off, do people follow it when it's on? Or they just, throw their hands up and say, oh, we haven't been using this all this time. Why do we need to use it now? That's going to be a big challenge for us.
Well, what you're telling us is that this is not an open-ended, it's not a closed, hard, this is the end of masking, and so it's not going to happen again. There is a likelihood we could go back to this regime.
Yeah, and I think that's quite important to recognize that this is not the end of, COVID restrictions. We now in a period where we can afford to do it, but we would very easily go into a period where we can't afford to allow this. And so we have to be ready to deal with that. Now, I want to make one critically important point, and that is that it is really important that we try to prevent every possible infection, not because we worry that patients are going to go to hospital when they get infected, but because we are also worried about the long-term consequences. Now there's long COVID that occurs in about 10 to 20% of people. We know that patients who have had COVID-19, they have an increased risk of heart attacks or stroke or myocarditis. They have a higher risk of diabetes and even neurological illness. So you can see that there are many reasons why we should be trying to prevent infections. Yeah. Now, the thing that people say, okay, we've had infection, everybody's infected. That's not the issue. The issue is that reinfection is also one of the causes of these kinds of long-term sequelae. So we have to avoid any new infections, and we have to avoid reinfections in order to minimize these impacts. And these are long-term impacts. They're not immediately apparent.
Yeah. Prof, I want to quickly just branch into the other infection risk that we're facing in South Africa, this monkeypox. We've confirmed patient 0, a 30-year-old Johannesburg man who didn't travel outside the country. How should our country manage this?
So monkeypox is a very different cup of tea. It's not anything like COVID-19. To start with, it's a DNA virus. So it's a completely different kind of virus. But one of the important things about monkeypox is that it does not spread before a patient becomes symptomatic. So when a patient gets these rashes, it's really in the rashes that the virus is able to spread, very much like how smallpox used to be. Now, many people don't know about how smallpox was because they are too young to remember all of that. It wasn't there because we eliminated it by that time. But like smallpox, monkeypox only spreads through close personal contact. It's only rarely spread through the respiratory route. So that's one of the reasons why smallpox it's not explosive. It's not going to go from one patient today, 20 patients in a few days, and then 100 patients and 1,000 patients. It doesn't work like that.
So would you say, and a quick answer on this, are we at risk of an outbreak?
No, I don't think so, because all the countries that have been reporting monkeypox, they've had a few cases, but now globally the cases are slowly diminishing in terms of the rate of increase. So I'm not overly concerned. And remember, there's not been a death yet from monkeypox. It's still quite a mild infection, as we are seeing.
All right. Thank you so much for your time. We appreciate it as always. Professor Salim Abdool Karim, epidemiologist and director of Caprisa.